an eminent health personality, or a leader with an important legacy in the field of public health. These prizes honor individuals and institutions for their outstanding contributions to different aspects of public health. Through these prizes, we seize the opportunity to celebrate the relentless work accomplished by our very own health professionals across every region and multiple member states with one common goal, that is health for all. I have the pleasure to welcome amongst us the winners of these prestigious prizes, as well as the distinguished representatives of the founders of the prizes. Please refer to document A77 INF./1, awards, for more information on their work and achievements. I will now give the floor to the Director General, who would like to say a few words. Dr. Tedros, you have the floor.
Thank you, Mr. President. The 2024 Public Health Prizes and Awards celebrate individuals or institutions that have made a significant contribution to global health and whose work has extended far beyond the call of normal duties. I thank the members of the Executive Board who gave their time to recognizing the public health achievements of these dedicated health professionals. I also thank the foundations and institutions who so generously support these awards. I'm pleased to note that 6 of the 8 awards this year will be presented to women, either for their individual achievements or for their leadership of the institutions that will be recognized. The dedication of the laureates is remarkable, and the innovations they have designed are making a significant difference, especially for the most vulnerable, empowering patients and communities to improve their health. You are an inspiration as we continue our shared journey towards a healthier, safer, and fairer world. I salute you all, and I thank you. And back to you, Mr. President.
Thank you. It is now my pleasure to announce that the 2024 Ihsan Dogramaci Family Health Foundation Prize has been awarded to Dr. Jamila Teza Yeza Al-Abri of Oman. I invite Professor Tomris Chuman, President of the International Children's Center, to address the Assembly on behalf of the Ihsan Dogramaci Family Health Foundation. Madam, you have the floor.
Thank you. President of the World Health Assembly, Mr. Minister, Mr. Director General, Excellencies, ladies and gentlemen. I would like to welcome you to this special day where I have the honor to present the Ihsan Dogramaci Family Health Foundation Prize in my capacity as the President of International Children's Center and as a member of the Selection Committee. Professor Ihsan Dogramaci was an eminent international figure in child health and higher education, as well as a visionary leader. His contributions to medicine and education were not confined to Turkey, but extended globally, improving countless lives. His leadership roles in the work of WHO, UNICEF, and International Pediatric Association were truly remarkable. In the words of the former UN Secretary General, Kofi Annan, he was truly a model citizen of the world. In 1946, he had the historic opportunity to be a signatory to the Constitution of the World Health Organization. He believed in the mission of WHO, and in 1980, he established a foundation within WHO to reward individuals who have given outstanding service to family health. This foundation, which is the most important reminder of Ihsan Dogramaci's dedication to WHO, has brought us together today. To date, this prestigious prize has honored 19 remarkable individuals. This year, the selection committee, among several distinguished candidates, chose Dr. Jamila El Abri from Oman to be the 20th recipient of the Ihsan Dogramaci Family Health Prize. Dr. Abri is an obstetrician gynecologist with a PhD in public health. She has extensive experience in the field of maternal and child health, as well as women's health and reproductive health. As a woman scientist, she has shown remarkable leadership in women's issues. I am sure that Professor Ihsan Dogramaci would have been extremely proud to see his prize awarded to Dr. El Abri. On behalf of the selection committee, we extend our warmest congratulations to her. Thank you.
Thank you. It is my privilege to present this prize to Dr. Jamila El Abri. I now invite Dr. Jamila El Abri to address the Assembly.
سيد الرئيس، أصحاب المعالي والسعادة.
President, Excellencies, Professor Tormen, President of the International Children's Center, dear colleagues, I am proud and honored to receive the Ihsan Dogramaci Family Health Foundation Prize, and I pay tribute to its founder, Professor Ihsan Dogramaci, whose contributions were not limited to the promotion of child care and pediatrics, but also included other areas such as public health and medical education. As the WHO General Assembly convenes these days, let us recall that Professor Ihsan Dogramaci was one of the signatories of the WHO Constitution. Maternal and child health is a fundamental pillar of family health which reflects on the health of society. Although nearly 9 years have passed since the launch of the Global Strategy for Women's, Children's and Adolescents' Health 2016-2030, which serves as a roadmap for achieving the Sustainable Development Goals towards ensuring well-being and reducing morbidity and mortality, maternal and child mortality rates in the world remain unacceptably high. while most of these deaths are preventable. This calls for all of us to make more efforts to promote health of mothers and children, especially with the existing proven interventions. I am fully confident that this can be achieved. The fact that I have been awarded this prize reflects the attention devoted to my country, the Sultanate of Oman, to the promotion of the health of women, mothers and children, which has been achieved with the support and concerted efforts of officials at all levels and health workers. I wish to extend my sincere thanks and appreciation to them, in particular His Excellency the Minister, my colleagues in the Department of Women and Child Health, and all workers in the field of women and child health. This prize is a source of motivation for us to make further efforts and achievements. In conclusion, I would like to thank my beloved family for their support.
Thank you for your distinguished service and family health. It is my pleasure to announce that the 2024 Sasakawa Health Prize has been awarded jointly to Dr. Doreen Ramogola Masire of Botswana. I invite Mr. Yohei Sasakawa, Chairman of the Nippon Foundation and WHO Goodwill Ambassador for Leprosy, to address the Assembly on behalf of the Sasakawa Health Foundation. Sir, you have the floor.
Distinguished participants, it is my greatest honor and pleasure to congratulate this year's recipient of the Sasakawa Health Prize. Dr. Doreen Ramogola Masire of the University of Botswana. Also, as we mark the 40th milestone of the Sasakawa Health Prize, I would like to express my deepest gratitude to WHO Director General Dr. Tedros, members of the selection committee, and all who have supported this health prize over the years. As you are aware, the Sasakawa Health Prize was established by my late father, Ryoichi Sasakawa. He highly valued the importance of primary health care as endorsed in the Declaration of Alma Ata, which emphasizes the critical role of primary health care as the key to achieving good health. I fully recognize the importance of the spirit of the Declaration of Alma Ata, as primary health care contributes to, quote, the promotion and the protection of the health of the people, which is essential to sustained economic and social development and contributes to a better quality of life and to world peace, unquote. Dr. Doreen Ramogola Masire has been unanimously selected for her role in the development and implementation of Botswana's prevention of cervical cancer strategy, involving the entire community and traditional leaders. We highly honor the work of Dr. Masire for her embodiment of primary health care through her invaluable and versatile activities. Dr. Masire, we now present you this award, wishing you continued success and at the vanguard of primary health care. Congratulations.
Thank you. It is my privilege to present this prize to Dr. Doreen Ramogola Masiri. I now invite Dr. Doreen Ramogola Masire to address the Assembly.
Mr. President, Director General, Excellencies, ladies and gentlemen, it is a huge honor for me and my family to receive this prestigious award set up by the Sasakawa Health Foundation. Thank you very much, Mr. Sasakawa, and your dear departed father. I am humbled to have been my government's nominee, a government that recognizes the women's role as an important contributor to the socio-economic development of the nation. The award marks the collective effort of many. Immense gratitude goes to my current and past employers, the colleagues I have worked alongside, funders, both local, international, who have supported the work we do. My many patients, students, mentees, mentors, and coaches who have all contributed to my development as a professional and as an individual. Most importantly, I want to thank all my friends and family, especially my sister who's sitting right here, Masakawa. You have all stood by me, encouraged me, supported me, even when at times you thought what I wanted to do was a little bit crazy. Above all, I give glory to God for this grace and His grace that forever endures. Health is truly the most important wealth. Timely access to quality, affordable, and culturally acceptable health care is the cornerstone of this health and this wealth. Therefore, the development of the whole value chain of excellent healthcare requires equitable and inclusive legislative laws and policies which provide for a functioning healthcare system with sustainable financing coupled with adequate and fit-for-purpose manpower and leadership. This award has strengthened my resolve to continue working to improve the lives of my countrymen and women and create new knowledge that will benefit mankind. And again, my great gratitude to Sasakawa and his father for setting up this foundation. With that, ladies and gentlemen, I thank you for your attention.
Thank you for your outstanding innovative work in health development. It is now my pleasure to announce that the 2024 United Arab Emirates Health Foundation Prize has been awarded to the National Death Registry System of the Ministry of Health of Saudi Arabia. I invite Dr. Hussein Abdul Rahman Al-Rand, Assistant Undersecretary for Public Health Sector, Ministry of Health and Prevention of the United Arab Emirates to address the Assembly on behalf of the United Arab Emirates Health Foundation. Dr. Alran, you have the floor.
بسم الله الرحمن الرحيم.
In the name of Allah, the most gracious, the most merciful, Your Excellency Dr. Edwin Dikolotti, Minister of Health of the Republic of Botswana and President of the General Assembly of the World Health Organization, Your Excellency Dr. Tedros, Director General of the World Health Organization, Your Excellencies, Ministers of Health, Excellencies, members of delegations and representatives of participating organizations, ladies and gentlemen, may peace, blessings, and mercy of Allah be upon you. On behalf of the United Arab Emirates Health Foundation and on behalf of His Excellency Abdul Rahman Al Owais, Minister of Health and Prevention, I am honored to welcome you to this honorable forum that celebrates doctors, scientists, institutions, and personalities who contribute to enriching health work and strive to enhance the leading role of the World Health Organization in maintaining human health and safety. I also take this opportunity to extend my sincere thanks for the efforts made by all members of the WHO's Executive Council and its Secretariat to honor the winners of this prize. Ladies and gentlemen, the United Arab Emirates Health Foundation Prize is intended to serve as an incentive for health workers under His Excellency Sheikh Zayed bin Zayed, is intended to serve as an incentive for health workers, including scientists, researchers, and specialists, to make more achievements that benefit the different areas of health. It is a contribution in partnership with the United Nations system in general and the World Health Organization in particular to implementing projects and programs aimed at providing health care to everyone around the world. It is my honor to announce from this platform that the 2024 UAE Health Foundation Prize has been awarded to the National Death Registration System of the Kingdom of Saudi Arabia. This system, which operates through the Ministry of Health, is among the successful systems that contribute to the formulation and implementation of the national policy and strategy to provide health services for all successfully by saving time and effort in registering deaths electronically, which increases efficiency and management of health systems within the primary health care framework. This system is also an innovative and effective program to reach socially and geographically disadvantaged population groups and involve local communities in planning, managing, and evaluating primary health care programs. The UAE, with its contribution in granting the United Arab Emirates Health Foundation Prize, will continue to support the efforts made by healthcare researchers and scientists to find more effective methods in overcoming difficulties. In conclusion, I extend my thanks, appreciation, and congratulations to all of you who won the award this year and confirm once again that we will continue to play our role and do our best to achieve health and well-being for all. May the blessings of Allah be upon you.
Thank you. It is my privilege to present this prize to the National Death Registry System of the Ministry of Health of Saudi Arabia. I now invite Dr. Maram Alotaibi to address the Assembly on behalf of the National Death Registry System.
Ladies and gentlemen, it is a tremendous honor to receive the UAE Health Foundation Prize. On behalf of the National Death Registry System at the Ministry of Health, I would like to thank the World Health Organization, the selection panel, the Foundation representative, and WHO member states for this prestigious recognition. I am thankful for the unwavering support and visionary leadership of the custodian of the two holy mosques, His Majesty King Salman bin Abdulaziz, and His Royal Highness, the Crown Prince and Prime Minister Hamad bin Salman. I also express my heartfelt appreciation to their excellencies, Engineer Fahad Al-Jalajil, the Minister of Health, the Vice Minister, the Assistant Minister, and all the leaders who have contributed to this effort, including the Public Health Authority. I am immensely proud of our dedicated team, whose commitment was instrumental in achieving this milestone. Our kingdom has been at the forefront of this monumental advancement in healthcare under Vision 2030. Indeed, the Health Sector Transformation Program has served as a catalyst for a remarkable innovation, aligning seamlessly with the strategic plans of the WHO. Today, we celebrate a milestone in transforming our nation's health death registry system, improving the completeness and accuracy of our mortality data. This achievement will contribute to increasing life expectancy, reducing non-communicable disease, and traffic accident mortality rates. Ultimately, this will strengthen our public health planning and policy formation. This accolade goes beyond national boundaries and reflects our shared vision of enhancing healthcare systems. It is indeed a testament to what we can achieve through dedication, innovation, and collaboration. As we reflect on the aspiration articulated by our leaders, let us strive for excellence and set new benchmarks that enhance the well-being of our people and humanity. Thank you.
Thank you for your outstanding contribution to health development. It is my pleasure to announce that the 2024 His Highness Sheikh Sabah Al-Ahmad Al-Jabbar Al-Sabah Prize for Research in Healthcare for the Elderly and in Health Promotion of the State of Kuwait Health Promotion Foundation has been awarded jointly to the Chinese Geriatric Society and Dr. Ahmed Hamid Saif Al-Wahibi of Oman. I invite His Excellency Mr. Neza Al-Hayan, Ambassador of the State of Kuwait, to United Nations Office and other international organizations in Geneva to address the Assembly on behalf of the State of Kuwait Health Promotion Foundation. Your Excellency, you have the floor.
معالي رئيس الدورة الدكتور أيدن ديكولوتي وزير الصحة بجمهورية بوتسوانا.
Dear brothers and sisters, peace and God's mercy and blessings be upon you. Your Excellencies, Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, Excellencies, distinguished ministers, and heads of delegation, dear brothers and sisters, Peace and God's mercy and blessings be upon you. It is my pleasure and honor to be here today at the World Health Organization on the sidelines of the 77th World Health Assembly at this award ceremony. And this is to celebrate His Highness Sheikh Sabah Al Ahmad Al Jaber's Al Sabah's Prize for Research in Healthcare for the Elderly and in Health Promotion for 2024. May God's peace be with you. This prize represents a symbol of dedication and offers an opportunity to recognize the noble efforts being made to improve the quality of life for the elderly and to ensure their access to proper health care. This is a symbol of gratitude as well for all of these considerable efforts that are providing generous and dedicated contributions throughout their lives. The prize constitutes a beacon of hope and a powerful incentive to achieve the Sustainable Development Goals, as well as to promote health and ensure its alignment with the best health-related practices. It also reflects the constructive cooperation between the State of Kuwait and the World Health Organization, a cooperation that dates back to more than 6 decades since the State of Kuwait became a member of the organization in 1960. I am pleased to participate in this ceremony as representative of the State of Kuwait, and I would like to extend my heartfelt congratulations to the laureates of the prize for 2024, namely Professor Gao Fang, Vice President of the Chinese Geriatric Society of the People's Republic of China, and Dr. Ahmed Hamed Saif al-Wahibi, Head of the Elderly and Community Care Department at the Ministry of Health of the Sultanate of Oman. I present this award to recognize their outstanding achievement in improving care for the elderly and in recognition of their serious action and remarkable contributions. I wish them further progress and achievement in their endeavors to recognize the elderly and to promote their legitimate rights to health care. I hope that this prize will serve as an incentive for more innovation and will contribute to promoting global solidarity to safeguard the rights of the elderly to health care. We would also like to pay tribute to the co-sponsors of this prize. May God Almighty rest the soul of the sponsor of this prize in peace. Grant him mercy and forgiveness and reward him for his good deeds.
It is my privilege to present this prize to the Chinese Geriatrics Society. I invite Professor Feng Kao to address the Assembly on behalf of the Chinese Geriatrics Society.
Ladies and gentlemen, it's indeed a great honor for us to receive this prestigious award on behalf of Chinese Geriatric Society. I would like to express my heartfelt gratitude to the World Health Organization for recognizing us this award, and Kuwait State for setting this prize in favor of healthy aging. I also want to say that I'm deeply thankful to my colleagues and members of Chinese Geriatric Society, as well as our esteemed international partners for their unwavering support and dedication. The Chinese Geriatric Society, in promoting our country's Healthy China initiative, warmly embraces the concepts and principles of healthy aging advocated by the World Health Organization. Our society is committed to advancing research and innovation in geriatrics, conducting extensive health promotion and communication for the elderly, and providing the elderly-friendly services. We look forward to enhancing exchanges and cooperation with our international counterparts in the fields of geriatrics, gerontological care, elderly-oriented services, and smart senior care in the future. May we join hands together and make unremitting efforts to improve the health and well-being of elderly citizens around the world. Once again, thank you all.
Thank you. It is now my privilege to present this prize to Dr. Ahmed Hamid Saif Al-Wahabi of Oman. I invite Dr. Ahmed Al-Wahabi to address the Assembly.
اسمحوا لي أن ألقي الكلمة واقفاً.
Please allow me to make this statement standing up in honor of this organization that is helping humanity. On behalf, may Allah's peace, mercy, and blessings be upon you. Mr. President, Excellencies, distinguished participants, it is a great pride to receive His Highness Sheikh Sabah Al-Ahmad Al-Jaber's Al-Sabah's Prize for Research in Healthcare for the Elderly and in Health Promotion. This is a prize that is awarded by the World Health Organization. This prize in the area of research in healthcare for the elderly and in health promotion reflects the importance placed on the elderly as a key development priority in health programs. This prize represents a symbol of recognition, appreciation, and gratitude towards the contribution of scientists and their strenuous efforts to achieve comprehensive development in line with the values, customs, professional and humanitarian obligations, and health-related goals with a view to achieving progress in the 17 Sustainable Development Goals. From this rostrum, I am pleased to accept this prize not only on my behalf, but also on behalf of all health workers in the Sultanate of Oman, including, in particular, His Excellency Dr. Hilal bin Ali Al Sabti, who have been a key element in everything we have achieved so far and in future activities in the field of healthcare development by adopting best practices in healthcare to serve the elderly in the Sultanate of Oman and the region. This prize is a personal dream that came true today and will motivate me to continue working hard to develop this field and build the capacity of health workers to serve this important segment in society. I thank those involved in the organization of the award and thank you all.
Thank you to the two laureates for their outstanding contributions for healthy aging. It is my pleasure to announce that the 2024 Dr. Lee Jong-wook Memorial Prize for Public Health has been awarded to Dr. Baida Al-Rawahi of Oman. I invite Dr. Lee Suha, President of the Korea Foundation for International Healthcare, to address the Assembly on behalf of Dr. Lee Jong-wook Memorial Fund. Sir, you have the floor.
Honorable President, His Excellency Dr. Tedros Adhanom Ghebreyesus, Director General of WHO, distinguished guests, delegates, ladies and gentlemen. It is a great honor for me to present the Dr. Lee Jong-wook Memorial Prize for Public Health at this assembly, representing Korea Foundation for International Healthcare. COFI is a public agency established by the Korean government 18 years ago, aiming to advance global health cooperation, and has presented this prize to honor the late Dr. Lee Jong-wook, who was the 6th Director General of WHO and dedicated his life to serving the disadvantaged. I am very pleased to announce that this year's laureate is Dr. Bader Al-Rawahi from Oman. Dr. Bader has been a pioneer in scientific, programmatic, and policy initiatives to provide vaccines to Oman communities. In addition, he assisted healthcare programs in neighboring countries suffering from war and served as an expert for various international public health organizations. Dr. Bader's outstanding contributions are sufficient to warrant this prestigious award which values dedication to public health and health equity. On behalf of everyone here, I want to extend our sincere gratitude and warmest congratulations to Dr. Bader. Dr. Lee Jong-wook Memorial Prize for Public Health will continue to honor those who have demonstrated unwavering dedication to public health, and we hope this will inspire and encourage individuals worldwide who are committed to advancing public health. We will continue our efforts to improve global public health in collaboration with Ministry of Health and Welfare of the Republic of Korea, and will always stand with WHO on that path. Thank you very much.
Thank you. It is now my privilege to present this prize to Dr. Bader Al-Rawahi. I now invite Dr. Bader Al-Rawahi to address the Assembly.
سيد الرئيس أصحاب المعالي.
Dear Mr. President, Your Excellencies, ladies and gentlemen, with all humility and gratitude, I am honored and immensely proud to receive the Dr. Lee Jong-wook Memorial Prize for Public Health, awarded by the World Health Organization. On this cherished occasion, I would also like to express my sincere gratitude to the members of the selection panel who have chosen me for my efforts in promoting health equity, universal coverage, and health access. At the outset, I would like to express my sincere gratitude to my family and to the outstanding public health team who have substantially contributed to the achievement of our objectives. The commitment of the Minister of Health for Oman, managed by Health Minister His Excellency Dr. Hilal Al-Sabti, is helping to improve health and well-being for all, and has had a significant impact on my success as well. This is why I would like to express that the Ministry for Health for their support and guidance over all of these years. As Director of the Infectious Diseases and WHO expert, I have been able to witness myself how equitable access to health care can have an impact on the lives of individuals and societies. And this is why it was necessary to ensure this access to all, including displaced persons and migrants. We have been able to provide access to vaccines, diagnostics, and treatment. As you know, there have been many campaigns around the world for vaccination. Our national vaccination campaigns has allowed us to enable access to all segments of society to achieve high coverage rates. Our humble objective, which was to not leave anybody behind. I am very proud of all of our contributions that we have made together. Some examples of these have been our contributions in the global effort to fight against polio and measles. We have received the WHO certification for Oman regarding the end of the transmission of measles and rubella in 2016. And we have also been declared as a country where there has been an elimination of mother-to-child transmission of HIV and syphilis in 2022. We have a center that is ranked first in the world for effective vaccine management with a 99% score. I would like to thank you once again for this recognition and this award. Together, we will pursue our shared journey towards a better and brighter future for health equity. Thank you.
Thank you for your commitment to improving public health. Before having the pleasure to announce the laureates of the 2024 Nelson Mandela Award for Health Promotion, please allow me to share that this prize was established upon the initiative of the Ministers of Health of the Member States of the Africa region in 2018, on the occasion of the centenary of the birth of Nelson Mandela, and therefore I'm particularly proud to announce its laureates today. The 2024 Nelson Mandela Award for Health Promotion has been awarded jointly to Professor Buntlembongwe of Botswana and to the National Institute of Mental Health and Neurosciences of India. I invite His Excellency, Mr. Mxolisi Nkosi, Ambassador, Permanent Representative of South Africa to the United Nations Office at Geneva, to address the Assembly. Your Excellency, you have the floor.
Thank you very much, Mr. President, Director General, Your Excellencies, ladies and gentlemen. South Africa is honored to take part in the annual WHO Nelson Mandela Award for Health Promotion that recognizes outstanding contributions to health promotion by individuals or entities across the world. Let me express our most sincere gratitude to the Director General, Dr. Tedros, for establishing this award. And as you have correctly indicated, Mr. President, the award was established upon the request from the Ministers of Health of Member States of the African region in 2018 on the occasion of the centenary of the birth of Nelson Mandela and the 40th anniversary of the Alma Ata Declaration on Primary Health Care, which has been implemented focusing on local communities essential to achieving universal health coverage. Please allow me to convey my deepest congratulations and indeed appreciation to the selection panel for the decision to jointly award Professor Buntlembongwe from Botswana and the National Institute of Mental Health and Neurosciences from India, which were also endorsed by the 154th session of the Executive Board. South Africa is indeed honored to be home of a global icon who is associated with this prestigious award. As President Nelson Mandela said, a fundamental concern for others in our individual and community lives would go a long way in making the world the better place we so passionately dream of. Mr. President, allow me on behalf of the government, indeed the people of South Africa, and the Nelson Mandela Foundation to express our sincere gratitude and congratulate Professor Buntlembongwe and the National Institute of Mental Health and Neurosciences, who have been nominated as laureates of this prestigious award. We note with appreciation the important role that Professor Mbongwe has played as a passionate tobacco control activist to influence her government's policies to protect children, youth, pregnant women, and workers. We also salute the work accomplished by NIMHANS to design and implement community-driven initiatives to improve the mental health of the people. Let us again recall the words of Nelson Mandela. What counts in life is not the mere fact that we have lived, it is what difference we've made to the lives of others. May this award continue to inspire your work as well as others in the effort to follow the path towards ensuring health for all and in promoting the social equity ideals that Nelson Mandela represented. Once again, we congratulate the two laureates. I thank you.
Thank you. It is my privilege to present this prize to Professor Buntle Mbongwe. I now invite Professor Buntle Mbongwe to address the Assembly.
Mr. President, ladies and gentlemen, with deep humility, I'm delighted to receive this prestigious Nelson Mandela Award for Health Promotion. The award comes in the wake of a strong partnership between the Botswana's Anti-Tobacco Network, which I lead, the Ministry of Health, civil society organizations, the media, and my employer, the University of Botswana. Mr. President, it never dawned that one day I will be standing before this assembly to receive such a prized award, which derived its name from Nelson Mandela, who fearlessly stood for what was right, for his people, inspired millions across the world to do good and to work for the common good. I am so grateful. Over the years, my work has focused on tobacco control, thus promoting and advancing healthy human livelihood. My work has centered on changing people's behavior and shaping public policy to prioritize public health over profits. It is touching that this award comes on the World No Tobacco Day, with the theme protecting children from tobacco industry interference. Ladies and gentlemen, safeguarding future generations from the harmful effects of tobacco by addressing targeted marketing towards youth cannot be overemphasized. I'm proud that Botswana recently won the Integrity Award for its unrelentless resistance against the influence of the tobacco industry. I call upon all countries of the world to unapologetically embrace a pro-health and livelihood strategic agenda. In conclusion, I am deeply thankful to the profound recognition by my country, Botswana, WHO, and the selection panel for the Nelson Mandela Prize. I thank my family for the support they have accorded me throughout this journey. In particular, I thank my husband who is here with me today. Thank you, Jared. I thank you all distinguished guests. Thank you.
Thank you. It is now my privilege to present this prize to the National Institute of Mental Health and Neurosciences of India. I invite Professor Pratima Mathi to address the Assembly on behalf of NIMHANS.
Thank you, Mr. President. Namaste to all the excellencies, dignitaries, esteemed invitees, ladies and gentlemen. Thank you, Director General and the Executive Board of the World Health Assembly for considering the National Institute of Mental Health and Neurosciences, NIMHANS, India, for the prestigious Nelson Mandela Award, which I accept on behalf of my country and my colleagues with great humility. An institute of national importance, NIMHANS in Bangalore seamlessly combines mental health and the neurosciences, delivering exceptional patient care, high-quality training, and cutting-edge research in mental health and neurosciences, and we serve more than 600,000 patients annually. We train postgraduates in more than 90 disciplines. Our hallmark lies in our multidisciplinary and integrative approaches to mental health care. Our claim to this award stems from our role as pioneers in community-driven initiatives for mental health. We spearheaded the district mental health program, training primary healthcare workers, established the NIMHANS Digital Academy to bolster human resources, and have led many human rights initiatives to improve care for persons with mental illness. Our comprehensive array of awareness and care programs spans the entire lifespan, including initiatives like the Samvad for children, the Life Skills Program for youth, the Yuva Spandana, substance use prevention, tobacco quitline services, the Stree Manoraksha for women, and the Vayomanasa Sanjeevani for the elderly. From the psychosocial helpline established during COVID-19 to guiding the establishment of the country's Telemanas digital initiative 14416, we have helped millions in distress. Extending our impact beyond borders, we have trained healthcare providers in numerous countries across our region. As my institution completes 70 years as the first postgraduate institute for mental health in India, and we commemorate the golden jubilee of my institution, NIMHANS, my deepest gratitude to our government, particularly the Ministry of Health and Family Welfare, to all our partners, to our mentors, particularly Professor Norman Sartorius, who's here today, to our patients, and to our beneficiaries. Thank you very much. We are deeply honored and receive this prestigious award, which inspires us to continue our mission with renewed passion and commitment. Thank you very much. Namaste.
Thank you for the two laureates for that significant contribution to health promotion. Before we conclude this agenda item, please allow me to thank sincerely the Executive Board for its leadership in this important process among the many duties. Please also allow me to congratulate again the laureates for their inspiring achievements. We hope that they continue the essential work to bring health for all. This concludes the consideration of item 7 of our agenda. I invite our distinguished audience to please stay in the room